I'm pleased to be joined today on Health Beat by Dr. Yemi, a urologist with Faith Regional Physician Services Urology in Norfolk. And today we're going to be talking about hematuria. So Dr. Yemi, what is hematuria and what causes this condition?
Well, hematuria, in plain speaking terms, is basically blood in the urine. There's a couple of ways that can actually present. Sometimes people will actually see the blood, when they pee or when they get up from having peeing. And the other way that actually it is more commonly picked up is when you go to your doctor's visit and you give a urine sample and then they do a little test with a chemical strip and the doctor comes out and tells you that there's some blood in your urine. The main causes can be varied. It can be something that's coming from your kidney or coming from the tube that joins the kidney to the bladder, which we call the ureter. It may be something from the bladder itself. It may be something from the prostate in men. Various causes of hematuria include kidney stones, but more worryingly, we try to exclude malignancies such as a kidney cancer or a bladder cancer, or even sometimes prostate cancer that can present with hematuria.
So what does the treatment look like?
That's a very good question. Before we actually get to the treatment, we need to decide where it's coming from, because depending on where it comes from, there are going to be different treatments associated with that. So one of the things that I tend to do is I see the patient in the office and we kind of talk about if they have any associated symptoms. If there's pain associated with it, that might signify maybe it's more of a kidney stone. It's actually the painless blood in the urine that's actually more worrying, because that indicates that it might be a malignant condition.
I see.
And in that sense, we send the urine to make sure there's no infection. We do a CAT scan, and then we might sometimes have a look inside the bladder with a cystoscope.
I see. Well, we want to thank you for being here today. I know our viewers are going to appreciate the information.
I really appreciate you inviting me to talk today.
Thank you. And that's Health Beat, brought to you by Faith Regional Physician Services.